We have done a series of stories in our investigative unit about the overprescription of narcotics.
Yeah.
We haven't heard from you on that. What do you think needs to be done? What is your office doing, if anything, about the overprescription of narcotics?
Well, we began this discussion perhaps 5 years ago when Bob Gates and I were fresh, and I was fresh in this position, and he was reconfirmed in his. We held a joint mental health conference between the two of us, and that's been an ongoing activity. Very little of what we do in VA originates here. Most of what we work on originates in DOD, so this has to be a joint discussion. And so our prescribing opioids is something we both pay attention to.
You and the Pentagon?
We do. It's a collaborative discussion. We've come up with rules that govern how we do this. Several years ago, I asked whether or not we were courageous enough to ask ourselves whether we over-medicated patients. And based on asking that question, and one of our Veterans Integrated Service networks, one of our health networks, went to work about 3 years now. And through their efforts of coming up with alternative therapies and looking hard at how we wrote prescription drugs, we have reduced opioid prescriptions by 50%. And we have reduced, in this one network, OxyContin prescriptions by about 99%. So a tremendous drop in the need to use. The caution here is to make sure that we have good working alternative therapies, and it appears we do. And so we're taking what we've learned here in this one network and spreading it throughout the rest of the VA system.
You're looking systemically at how doctors prescribe painkillers and how they can stop?
Yes, by providing alternative therapies and also working in a gradual method to reduce the consumption of these highly addictive drugs. So more work to be done, but this is something we are constantly looking at, how to be better. And for us, it's better care for veterans, how to take better care of people that need our help.